For centuries, Uzbekistan has been a center of science, knowledge, and medicine. This land has given the world great thinkers and scholars whose discoveries became the foundation of global civilization. And today, we continue this tradition, opening a new chapter in the history of our region. We are proud to present our new project, CAU Hospital, Cleveland Clinic Connected, a medical center that unites the rich heritage of Uzbekistan with the expertise of one of the world's leading hospitals, Cleveland Clinic. This collaboration is establishing the CAU Medical School as a center of excellence for the future of medicine.
I am Dr. Tommaso Falconi. I am a professor of obstetrics, gynecology, and reproductive biology at the Cleveland Clinic. I'm also Executive Vice President and President of International and Emerging Markets for the Cleveland Clinic. At the Cleveland Clinic, our mission has always been clear: caring for life, researching for health, and educating those who serve. We believe it is our moral responsibility to touch as many lives as possible. And through collaborations like this, we're able to extend our model of care to patients no matter where they are. With our over 100 years of experience, Cleveland Clinic has developed proven expertise and best practices. As a global leader in healthcare, we're excited to share our knowledge. Our collaboration with Central Asian University will focus on hospital design and patient flow rooted in efficiency, innovation, and patient-centered care. Our collaboration doesn't stop there. We're equally committed to supporting the next generation of healthcare professionals. This includes the development of medical education programs, a nursing school, and simulation exchanges to ensure that physicians and nurses are equipped with the knowledge and skills to deliver world-class care. We will also share expertise in areas like physician recruitment, supply chain management, and the integration of digital information systems, critical components of a modern healthcare facility. Through clinical observerships, visiting lectures, and scientific exchanges, we will foster a dynamic learning environment that benefits both our institution and respect the local culture. Together, through this strategic collaboration, we can make a lasting impact on healthcare in Uzbekistan. We're excited about the journey ahead with Central Asian University.
So the ambition for this project was, for us as a collective, was to create, first of all, a world-class renowned facility that would be recognised not only for the technological advancements that we're going to be using and encapsulating within the new hospital, but also from the greenest, from a sustainability perspective, from a wellness perspective, an ease of use perspective, but most fundamentally is putting the patient at the centre of everything. So what does that mean? It means that we had to create a building that would actually aid and help in the wellness and the betterment for any patients that actually come to the hospital. It means that we had to create a building that the doctors and nurses, anyone who's working in it, felt as if they were part of a building that was exceptionally special. The ambition has also been taken from ourselves, spending over 2 weeks with the group in Tashkent, the doctors, the nurses, the students, just to understand, first of all, culturally, what works very well, but more importantly, where they want to go and where they see themselves in the future with this new hospital. So the ambitions and the bar is set very high for us, but we're really thrilled and overjoyed to be working this project because we're really enjoying working on it and we're looking forward to the outcomes. So what's going to be in this new hospital? First of all, we've got 2 basement levels. We're going to have over 2,200 car parking spaces. On the ground floor level, we're going to have the main atrium and entrance, the outpatient clinics, as well, most importantly, the accident emergency department to the north of the building with its own access. On level 1, we're going to have further outpatient clinics, as well as all the imaging facilities. So level 3, probably the most critical floor in our new hospital, is where the all theatres. We have 8 of them located here, and this is where all surgical procedures will be undertaken. We'll also have day surgery located within this floor as well. Directly above level 3, the surgical, is what we're calling the winter garden, and it's going to be a place where anyone in the hospital can go just to break out, to go and get a breath of fresh air, go and experience some greenery, or indeed go and look at the views, the wonderful views that are going to be around, that are around this new hospital. So then jumping up to the next level, we have 2 levels of inpatients. So this is the wards that I said earlier that are all centrally positioned with the cores servicing them all. 120 beds that we have on these 2 floors. And then to top it all off, we've got the helipad. So the helipad is going to be for accident emergencies, for any immediate care. So in summary, the new hospital for Central Asian University and Cleveland Clinic, we are looking, first of all, to attracting the best doctors, the best surgeons, the best students that ultimately will work in this new hospital. It will also meet the needs of all the patients who are going to come and visit there and get treated there. We believe this hospital will be one that represents the future and where healthcare is going in Tashkent in Uzbekistan.
Ladies and gentlemen, esteemed guests, today marks a significant milestone in our journey towards transforming healthcare in Uzbekistan and the surrounding region. We're not just celebrating the start of a construction for a new hospital, we're laying the foundations for a centre of excellence, which in the coming years will embody the essence of modern medicine. This project brings together the unparalleled standards of the Cleveland Clinic, the visionary architecture of HKS, and the strategic foresight of Central Asian University and its founder, Mr. Jahangir. Together we are creating more than just a hospital. We're establishing a hub where care, education and research converge to the benefit of patients and their families.
Cleveland Clinic is ranked as the 2nd best hospital group in the world by Newsweek in 2025. Our students have the opportunity and the access to the best medical knowledge in the world and had the opportunity to go to the US as well to observe the best doctors in the world and learn from the top specialists. Also, with this collaboration, we bring the best international medical knowledge to Tashkent, and we're able to teach our students the most updated diagnostic and treatment protocols to become national and international well-known doctors here in Tashkent at our university. And as a board member for the Board of Trustees, it's a great honor to be part of this project and to help our students to implement the best medical knowledge and update medical knowledge, and also to be able to provide access to this medical knowledge through this collaboration. Our students will have the opportunity to work in Cleveland Clinic Hospital Tashkent as part of our Central Asian University Hospital. And they have the opportunity to consult complex cases with the doctors from the US, and also to have access to a world state-of-the-art simulation center, which will be part of the new Central Asian University Hospital, which will hopefully be finished in 2027.
Tashkent is becoming the new center of medical progress. CAU Hospital, Cleveland Clinic Connected, is a symbol of trust, knowledge, and hope for all of Central Asia. This is not a dream of the future. This is a reality that begins here and now.